The doctor's in, and we want to talk about something that at least 10% of women are suffering with, and it's endometriosis. Chances are you or someone you know is dealing with this painful condition. Dr. David Eisenstein, an obstetrician gynecologist from Trinity Health, is with us this morning. And doctor, one of the first items of note is that endometriosis often goes undiagnosed altogether, at least, or it's diagnosed late, right?
That's correct. We know that having endometriosis present in the body is very common. And a subset of patients who have endometriosis will actually have symptoms. And the symptoms include pain syndromes of various kinds, either with cycles or even beyond the cycles, sexual pain problems, as well as problems getting pregnant.
So some of this, sometimes doctors dismiss these symptoms and they say, oh, it's normal to have cramps. So let's first talk about what endometriosis is and why it's so painful. It has to do with cells growing in the wrong place.
Yes, the straightest explanation of what endometriosis is the growth of the tissue that is in the lining of the uterus, but gets outside of the uterus and will grow inside the body.
And why does that create such pain, doctor?
Well, beyond that simple explanation is the fact that what endometriosis represents is a whole bunch of problems inside the body. A lot of inflammatory chemicals, a lot of problems with the immune system in the body. And it's because of that process that we get the mechanisms where pain is created, and it gets in the way of achieving pregnancy as well. Okay,
so let's talk about treatment options. What's the beginning stage of treatment, and then what is the last resort?
To begin with, as you noted, a lot of patients talk about how long it takes to get diagnosed. And even in a time where we have so much information on the internet, and anybody can look up and learn about this story with endometriosis, when you survey patients, they will still talk about having to go through multiple doctors and many years before a label is put on this and active treatment is started, which is, there are many reasons for people saying that in surveys, but it also means we as doctors have to listen and give more time, which is a precious commodity in medicine today.
Right, that's the first step towards getting treatment, is being heard and getting a diagnosis.
Exactly.
So once you get that diagnosis, at what point do you go to surgical options?
Well, to diagnose endometriosis specifically, surgery is required because by definition, you have to do a biopsy to confirm the presence of that disease. Imaging can be helpful, such as ultrasound or MRIs, but that is not 100% either. So it's a combination of the story that the patient tells you, what your exam tells you as well, and what the patient's goals are. And you can initiate treatment that's medical before you have a specific diagnosis by surgery. And there are different philosophies of approach. Some are very surgery forward, that they will say you have to operate to make that diagnosis first. But there are options to be more conservative and try medical treatments to see if that helps first.
Let's talk about the robotic surgery. Is that considered on the newer side of treatment for endometriosis, and why is it better, less invasive?
When we talk about robotics, it's a tool for doing laparoscopic surgery, which is that kind of surgery that's through keyhole incisions, and we enter the body with a camera and very small instrumentation through about 5mm or 8mm incisions. So the robot is a tool to do that. And its virtue in endometriosis is the fact that the camera on the robot platform gives you an enlargement of the image, gives you a 3D image, which helps with depth perception. And when endometriosis creates invasiveness in the body and endangers a lot of vital structures, the facility of the robot for very fine dissection is a great virtue to be most complete with your dissection and to avoid injury and complication. I
want to get to fibroids just in our remaining few seconds here, because that's something that also goes undiagnosed, I feel like. What does that feel like, and why is that important to get that diagnosis?
You know, it's funny, patients always ask me, because fibroids are so common, they say, what causes it? And I'll say to them, you know, if you can figure that out, you got a Nobel Prize in your future. It's so common and so prevalent, and yet we don't know fundamentally why they start in the first place. And they can go undiagnosed until they are quite large or symptomatic as well. And the symptoms that come up are most typically abnormal bleeding, bulk symptoms and pain, and also problems with fertility as well.
Okay, but again, something that you need to do a little work to. The fibroids are growths. Give us the simple definition of a fibroid, doctor.
They're tumorous growths, generally benign, and they come from the muscular wall of the uterus.
Okay. Man, it's a complicated part. It's an incredible part of a woman's anatomy, but with it can come some complex problems too. So thank you so much, doctor. It's always good to keep moving that conversation forward. We appreciate it.
Thank you. My pleasure.
Ryan?